Graduating students will ask me how long should I be studying for my NCLEX, for my boards, and I always tell them that it is best to take your boards as soon as you are able to. We start preparing our students for their state license day one. So the way that we phrase our exams, the way that the questions are asked, the clinical opportunities that are presented, all of these are building so that when they graduate, there should not be a gap in when they take their boards.
Studying for the NCLEX takes a significant amount of time. However, within the program, it is a 16-month program, and we are slowly introducing concepts to students. So as far as all of the assignments, all of the assessments, it is slowly getting ready for students to actually take that NCLEX exam.
We start asking our students exam questions in the NCLEX style. So our students have a lot of practice on working through some of these tricky or ambiguous questions that oftentimes are presented in NCLEX or in their state boards. It can be challenging because there are more than one right answer. And I think it's important for nursing students as they prepare for their boards to think about what's not the right answer, but what is the best answer. Through test-taking strategies and more practice, you can start to eliminate those answers that may not be the best one.
Students at Xavier's ABSN program automatically have the 3-day ATI live review as part of their last semester here, and it's NCLEX preparation. So not only is the NCLEX-prep embedded throughout the entire program, preparing them for the NGN NCLEX-style questions, then they're also given the 3-day live review, which many students in other programs have to pay for separately. They have a product called Board Vitals, which is actually NCLEX preparation questions that they can go through and practice. The other thing that they can do is the ATI resources are available to them for 6 months after they graduate. They also receive an NCLEX review textbook. The NCLEX has a very specific blueprint, and it has certain percentages of major exemplars that will be covered on the NCLEX, but there's no predictability to what students will get when they sit for the NCLEX on certain topics. They do have easy versus more difficult, challenging questions, and students have to achieve a certain level to pass the NCLEX, but we don't know if they're going to have questions on obstetrics and very little on behavioral health, whereas another person might sit and they might have questions that are on nutrition and pediatrics. So it's all just randomization.